Welcome to Modern Management of the Older Adult, brought to you by the Institute of Clinical Excellence.
Team, welcome to the PT on Ice Daily Show. My name is Julie. I am a member of the Older Adult Division, and this morning I am going to take you all through a general workout for the hospitalized patient. All right, so how can we start to use our loading strategies and circuit training, EMOMs, etc. for our sick folks who are in the hospital? Okay, so first of all, diving in, I'm going to give you a very generalized workout. So it's going to hit on gait, we're going to hit on balance, strength, power, and we're going to make it fun. All right. So we're going to be able to hit on all of those domains with this workout, but I'm going to keep it general. One very important point is that as you are thinking about how to modify this for your specific patient, always add movements and objects that are specific to their meaningful goal. If you've been around here for a while, you know that one of my most important philosophies is that we should take our patients' meaningful goals and dig into them incredibly deep so that we are able to create exercises that mimic the demands of that goal so your patient can make that link, okay? So let's go ahead and start this out. I'm gonna give you just the general idea of the patient avatar that I'm talking about. So this is a patient who requires mid to mod assist to stand up and then requires minimal assist, occasionally mod if there's a loss of balance to walk, and will require an assistive device, okay? So that is the general avatar that we're talking about with this patient workout. So take the patients that you're gonna see today or this week and scale up or scale down based on their ability level. Okay. When I am programming a workout for my patients who are in the hospital, the vast majority of them have the goal of walking. And I usually am going to prioritize getting them up on their feet and getting them walking in any way that I possibly can. Why walking? Most of the time, when I ask my patients, what would bring joy today? What would feel like a success during our session today? What is it that you're going to be able to do? And normally they tell me, Julie, I want to get the hell out of this damn hospital room. I just want to see outside of my door. The vast majority of my folks are going to tell me that. Many times, if they're receiving therapy 1.0, they're only being walked to the door and back, and that's it. So right away, I am thinking, let's get the hell out of this room. It is so psychologically helpful for someone who is only seeing those white walls, okay? For them to get out of that room and see other humans and have different scenery. I mean, think about our folks who are susceptible to delirium. This is really important to try and get past that threshold of their door. So that is typically the goal my patients are thinking about. That's the goal that I'm thinking about for my patients, all right? Okay, next, I'm going to make sure that I consider this walking goal, because for this avatar patient, we're going to say that we want to get them to inpatient rehab, okay? We want to advocate and we want to boost their reserve and their capacity so they can make it to inpatient rehab. We have to be very diligent about how our walking intervention is going to look. Because inpatient rehab is like playing a game. You cannot have your patient walk too far. So around 100-ish feet is kind of that cutoff. Or inpatient may look at that and say, this patient is too good. They're too functionally sound. They don't need inpatient rehab. They can go to a SNF or they can go home. On the flip side, inpatient rehab needs to know that your patient can tolerate the multiple hours of therapy they're going to be receiving a day. So you also want to be mindful of getting your patient to walk further than that 10 to 15 to 20 feet that may be to the door or to the door and back a little bit. So that is why I'm trying to focus on get past the threshold of that door However, we need to also cut the distance so that inpatient rehab doesn't look at them and say, they don't need to come here. So you gotta have that sweet spot in between. All right, so just setting that there. Okay, walking should come first. We're gonna work on different interventions, but walking, I always try and prioritize that first. Why? Because one, that typically is the patient's meaningful goal, right? Get the hell out of this room. And two, it's typically going to be the most challenging. So I want to do the most challenging thing first when my patient is very fresh, okay? I don't want to exhaust them with a bunch of other interventions and then have them walk when their legs are completely toast. So I'm going to do my walking intervention first and really put a priority on that. If you think about your workouts, for example, like when I'm in the gym and we have different blocks of exercises and different little workouts within the 60 minutes that we are there, I always go to the rower first. Why? Because I suck at rowing. The rower absolutely crushes me. So I want to make sure to do the most challenging thing first. I'm trying to get better at rowing before I'm exhausted from the other blocks of that workout. So think about that same way for your patient, okay? So the first thing I'm gonna do, set the entire space up, all right? So I'm clearing out space. I am trying to get a second pair of hands to be a chair fellow for me, okay? Because yes, I can guard a patient and bring a wheelchair behind them, but that's kind of dicey. I've done it all the time, but I would rather not. So I'm going to try and get a hold of someone to help be a chair fellow for me. So this patient is allowed to walk as far as they can in my capacity. My hands are not limiting their goal. So this is where ahead of time, before I'm planning to go see this patient, I will go find who their nurse technician is, and I will say, hey, I'm planning to see this patient in X amount of minutes or at X time. We really want to walk far today. I would be so grateful if you would be a chair fellow for us. It's really going to allow my patient to reach the goal that he or she has of walking X amount. All right. So collaborate with staff ahead of time. If you are ready to rock and roll with your patient and then you go up and try and find a second set of hands, that is not going to be as successful. Other people are busy. Their jobs do not revolve around when we want a second set of hands. So try and plan that ahead of time. If you add in what your patient's meaningful goal is, that will help, right? If I'm someone and a therapist came up to me and said, hey, will you help me walk my patient? That doesn't get me very excited. I don't want to put off my tasks to go do that. But if you came up to me and said, my patient's goal is to walk 50 feet today and they are so excited to be able to get home and be able to walk outside to do their yard work, can you help me work on that today? I'm gonna care a little bit more, right? I'm gonna give a shit about that. So maybe I'll put away the tasks that I have at hand to make time to help out my coworkers. Okay, so then I am going to sit down and talk through this with my patient. Now, I will tell you, and if you care, especially when you don't know your patient, to try and come up with a workout in a pretty buttoned up EMOM, it's not gonna happen most of the time because there's too many fluctuating things that could interrupt your session. The physician comes in, their vitals go crazy, their status is changing so rapidly. If I absolutely am married to doing a workout every minute on the minute, it's not gonna go that pretty, okay? So yes, you can strive to have You wanna have general guidelines for how much work you want your patient to do versus how much rest you want them to have, but I'm not making that strict, okay? So I think about it, I want this patient to do about 15 minutes of movement. That is my goal. I'm looking at 15 minutes because acute rehab will look at that and say, okay, that's moving towards that goal of 30-minute sessions, which are typically the shortest amount of sessions that a patient will see in inpatient rehab. So I start with 15. That's my general goal. Sometimes we get there, sometimes we don't, but that's what I'm starting with, okay? So I sit down with my patient. I have a whiteboard. I'm using those call don't fall signs that are typically all around the room. You've heard me say this many times if you've been around for a while. I take those down and flip them over. They're great whiteboards, and I start to write this down with my patient. And I'm telling them, we're gonna work on your walking. We're gonna work on your balance. We're gonna work on some strength, and we're gonna work on power, moving really fast. We're gonna prioritize your walking. And I'm gonna be having you work for 30 seconds at a time, about there. I am gonna give you rest, but I want you to listen to my cues. I want you to try and be working for the entire time that I have you on this clock. I promise I'm gonna give you rest, all right? That's as detailed as I'm telling my patient, first off. If I sit down and I say, you're gonna do this exercise, this exercise, this exercise for 20 seconds, 20 seconds, 20 seconds, 10 seconds rest, like they're not gonna remember any of that, okay? Many of them maybe they're on pain meds, their cognition is a little off. We don't need to get into the nitty gritties, and more often than not, our plan is going to change as we start rolling. But you want to have a general idea and start to track how much time they actually did work for, okay? So I always have my phone, I'm using my lap function so that I can track their progress, but don't overload them with details. All right, so let's get rolling on this workout. So the very first thing is I am going to have them walk as far as they possibly can for about 15 to 20 seconds, all right? We are trying to cover as much ground as possible. After that 20 seconds, and this is where I'm gonna be following with a chair or someone else is gonna be following them with a wheelchair, my goal for them is to then stand for another 20 seconds, 30 seconds. It's active rest. The most important thing I'm telling my patient is I don't want you to sit. That is 100% the last resort. I want you to continue standing. So we're going to try and walk as far as we can for 15 to 20 seconds, and then we are going to have active rest in standing for another 20 to 30 seconds about, all right? So that's what I'm telling them up front. I'm gonna put some music on. Please, dear God, don't make your patients work out in silence. It's completely sociopathic. Get some music on that they like, get them hyped up, and we're off. We're walking, okay? So they walk that amount of time. I'm letting them know how much time is left on the clock. Then in standing, I am making sure, don't sit, don't sit, don't sit, keep standing. And I'm going to have an activity that keeps them engaged. Just telling them to stand for 30 seconds is boring as hell. You probably wouldn't want to do that in a workout either, so I want to have some sort of activity. I always bring a deck of cards with me because it's easy to carry. I can put it in my pocket and I can come up with an activity. So I will play some sort of card game, right? So I can have that tray table out in the hallway or midway between the sitting edge of bed and the door, however far they get, and then we can sit there and play a game of war, anything. You know, just have them flip cards and name the suit or name the number. Have an activity that keeps them engaged, that is incredibly simple for you to also carry with you while you are helping this patient. So we play some card game for 20 to 30 seconds, awesome. And then we're back to walking, all right? So I'm gonna go through that for about 3 rounds, okay? So 3 blocks of that same exercise. Walking, standing, walking, standing, walking, standing. I keep that blocked, I keep that masked. So we get as much walking, standing endurance, we get some balances in there as well as we possibly can, all right? So after you go through that walking block, we are, 3 to 5-ish minutes in, okay? Then I'm gonna move towards strength and power. I am going to allow them to sit. We are going to move into doing some sit to stands and some power movements. And the power movement that I find is the easiest and it's fun is a pillow slam or a pillow punch, okay? So I will have a pillow. Many times I will get a Sharpie and I will write on the pillowcase some sort of motivational phrase. Many times for my oncology patients that was F cancer, or I write their goal, I write their name. I ask them, like, if you want to punch the crap out of this pillow, what do you want me to write on it? Something like that. So I will be having them do pillow punches, pillow slams. So my block here, where I'm working on strength and power, is I am going to have them do 3 sit-to-stands. I'm going to try and have them do that within 20 to 30 seconds, all right? Then as they sit down, I'll give them a little bit of rest, 10 seconds, 15 seconds, and then I'm going to have them do those pillow slams for another 20 to 30 seconds, okay? So I will hold the pillow and I will have them punch. You can be cueing them to do a hook, an uppercut, a cross punch. This is also specific if you have patients who like to box. They will love doing this pillow punch. Or I will have them do slams. So I will have them pillow over their head and they're slamming it down on their lap, or they're slamming it down on the armrest of the wheelchair, whatever it is. But you are getting some upper body and you are getting some really awesome power, right? Stimulating those type 2 muscle fibers during that exercise. And it's just fun. When people are sick and they're pissed off that they're in the hospital, it's really fun and engaging to just slam a pillow all around. If some of your patients love like chopping wood, I had a lot of patients who like to do yard work and chop wood. A pillow slam is very specific to that activity, okay? So that's my second block. 20, 30 seconds, 3 sit-to-stands, that's what I'm going for, a short rest, and then 20, 30 seconds, we're doing pillow punches or pillow slams. And I'm gonna do that 3 times, okay? So this second block, 3 times, that's gonna take me a little bit longer probably than my walking block. So we're looking at like 4 to 6 minutes, okay? And then the third thing we're gonna do is just go back to walking. It's a walking finisher, okay? So after they're done with that second block, I'm going to give them 1 to 2 minutes of rest, and then I'm like, okay, this is it. This is your finisher for this workout. I want you to walk as far as you possibly can. And usually by this time, we're crossed the threshold of the door. We can see everybody out in the hallway. The music is going. The people at the desk are clapping for my patient. I'm trying to get people involved so that there's a ton of motivation here to really go all out on this last walking effort. So that's the last thing we do, is we get back up and we are walking as far as we possibly can. And I am taking note of how far or the time that they're walking throughout this entire workout, right? Because we want to make sure that that patient knows and every other clinician knows how far they walk, so we continue to build on that goal. So I pump the music up even louder, and this is where you get really loud, cheering for your patient. Make it a big freaking deal that they are going all out on this last walking effort. And that's it. That is a very common generalized workout that hits on gait, which is the priority. We got some standing balance and endurance, strength, and power. That's how you can fit it all in. And if you add all those blocks up, our block 1 of walking and standing endurance with that added cog task, that extra engagement, then we have block 2 with sit-to-stands and pillow slams or punches, and then that last walking, that all-out finisher. That's gonna take, it'll be about 15 minutes, okay? Those blocks, typically, I'm looking at 3 to 5, 3 to 6 minutes of each of those blocks. Okay, I hope that this was helpful, that this gives you guys an idea of what you can use with your hospitalized patients this week. I would love to hear if you tried any of these blocks, anything of the workout that I just suggested, how you scaled it up for patients who are higher level, how you scaled it down for folks who are lower level. Let me know. I'd love to hear about it. I will finish off by letting you all know what the older adult division has coming up. The fall is so busy for us, which is awesome. We have a ton of courses. We will be in Michigan, Pennsylvania, Wisconsin, and California coming up over the next month plus. And both of our online courses, our level 1 and level 2, start in October as well. So ton of options to catch us on the road, ton of options to catch us online as well. All right, team, have an awesome rest of your Wednesday. Go help your patients in the hospital get strong as ever.
Thank you for listening to the MMOA podcast. If you found this helpful, please share with someone that could benefit. And if you're looking for more practical content to help you better serve older adults, head over to www.mmoa.online, where you can learn more about our free resources, our community, continuing education courses, and our certification. Once again, that's www.mmoa.online. Thanks for listening.